This is a public service announcement about surgical smoke safety.
Surgical smoke first became an issue when electrocauterization surgery started. Electrocauterization surgery is a surgical procedure in which high radio frequencies are used to cut, seal off blood, and cauterize tissue. This allows for very fine cutting of the tissues and fast coagulation of the blood vessels. Electrocauterization surgery greatly reduces the damage of tissues during surgery, but oftentimes will give off harmful toxins in the smoke that is produced. In this smoke, hydrogen cyanide, hydrocarbons, and fatty acids are produced. Some of these organic compounds, such as acrolein and formaldehyde, have been identified as carcinogens.
With surgical smoke, there is an impact on surgical staff. For example, short-term exposure to certain toxins, like acrylonitrile and benzene, can cause effects that include eye irritation, nausea, vomiting, headache, dizziness, weakness, and lightheadedness. Chronic exposure to these toxins can result in higher incidence of cancer.
The potency resulting from the pyrolysis of 1 gram of human tissue is equivalent to smoking 6 unfiltered cigarettes.
There are pathogens that may be transmitted in the surgical smoke to the surgical team during surgery. What is so concerning is that whatever may be in the patient's tissue, like bacteria or viruses, is transmitted into the air during electrocautery. That means that anyone in the room is breathing in that harmful air.
Approximately 77% of particulate matter within surgical smoke was found to be less than 1.1 micrometers in size, while standard surgical masks can filter particulate matter greater than 5 micrometers in size, and hence do not provide sufficient protection against smoke produced during electrocauterization surgery. Smoke evacuation is currently the most effective measure to reduce the exposure of surgical plumes to surgical staff. Smoke evacuation works through a combination of a triple filtration system that includes a charcoal filter, a high-efficiency particulate air filter, which is the pre-filter, and an ultra-low penetration air filter, which is used if larger amounts of plume are generated.
Unfortunately, not all surgical staff are made aware of the full risk that surgical smoke poses to them. In 2017, Karen Giuliano surveyed nurses at the AORN Global Conference and Exposition and discovered that 14% of nurses cited a lack of education on the dangers of surgical smoke. Our first recommendation is that surgical department management requires semi-annual classes about the risk of exposure to new and current surgical staff. It is important for surgical staff who are exposed to fumes, odors, and particles from electrocauterization surgeries to understand the risks associated with it due to the lack of knowledge about the exposure risks. Our second recommendation would be to promote the consistent use of surgical smoke guidelines through a pre-surgery checklist of safety measures due to the large portion of surgical staff who believe there is inadequate measures implemented to protect staff from the harmful effects of surgical smoke.